As a medical futurist, my job is to bring science fiction technologies into everyday medicine globally by letting patients lead the way. That's it. Quite simple, right? But if you ask patients and physicians what the major problems with healthcare are, they won't mention science fiction. They will mention lack of money, doctor shortages, losing faith in modern medicine, but not science fiction. But if you ask them what could be the first thing that should be improved, in many cases they will mention the human touch. We can improve the human touch, the trustworthy doctor-patient personal relationship. My point today, what I want to prove to you is very simple. I think we can improve the human touch with technologies. And as a medical futurist, I must be really honest here, I think we can improve the human touch only with technologies. And as a geek, let me add, only with more and more disruptive innovations. Because over the last few years, not even decades, just the last few years, medicine and medical technology have become like a science fiction movie. That's what we have to live through now, every single day. Exoskeletons, neuroprosthetics, science fiction technology is already here. And it's moving so fast, we cannot really adjust to that. Just one example. Before the early 19th century, physicians had to put their ears to the naked chest of the patient or the back of the patient to listen to cardiac and lung sounds. And that could create quite an awkward situation with, for example, female patients. Then came a French physician, Lenné, who came up with this wooden tube idea. He saw kids playing with that, and he thought that that could help augment, improve the lung and cardiac sound. So then it took him 20 years to get this message across to medical associations worldwide, 20 years. Since then, having a stethoscope has been the sign of being a physician. If there is a stethoscope around your neck, you are a physician. That's how it works now. And then one of the world's leading cardiologists, Eric Topol, said that for more than 2 years, he hasn't even used his stethoscope because he has a portable ultrasound in his pocket. And it's much better seeing the heart than listening to the cardiac sounds and draw conclusions from there. That's how fast it has become. And we just cannot adjust to that. We are not that prepared to see this technological revolution or explosion in medicine. Moreover, I want to put some pressure on anybody interested in digital health. There are no limitations anymore. If I need money for my project, I can crowdfund it. If I need expert information, I can crowdsource the information through online social media networks with millions of experts worldwide. If I don't have money to manufacture the first prototype of my idea, I can 3D print it with a local 3D printer. There are no limitations anymore globally if you want to make a product, an idea, a device, a service happen in real life in medicine and healthcare. If you have one internet connection, that's all we need now. And the third thing here is that, and just one example, how the technology could really help and improve the human touch. That's my favorite story about that. In 1996, the IBM supercomputer named Deep Blue had a match with the world's reigning chess champion, Garry Kasparov. And of course, Kasparov could beat the computer. There were headlines saying that that's the triumph of humanity over the computers. Then, 1 year later, 1997, they had a rematch, and Deep Blue could beat Garry Kasparov. That was devastating. Everyone was shocked. Kasparov said that in quite an angry way in a press conference, if he had access to the same massive databases, then he could have won the match. But he didn't, although the computer did. Since then, there have been advanced chess championships in which chess players can work together with programs, chess programs, and nobody can beat them. That's the winning combination, the human creativity and the computing power behind computers. So for the last 3 years, the IBM's new supercomputer Watson has been used at different clinics. And when the patient comes in, the doctor can focus on the patient while Watson can check the medical records, the medical papers on PubMed.com, medical textbooks, and it comes up with suggestions based on data, actual data and study conclusions. In the meantime, the doctor can focus on the patient, talk with the patient, look into their eyes. That's how the human touch should work. So now with more and more technologies, we can actually let the physicians do what they are the best at, providing care. Not typing information with 2 fingers on a keyboard or trying to find what they need. That's done. They can focus on the actual patient. So a new word of a technological explosion can bring this to us, can bring this to healthcare in a way that at the end we have something like this. The winning combination between the human creativity and the computing power of computers. But it will only work if patients will be the hackers of the healthcare system, if patients lead the way, if patients are the kings of healthcare, being in the center of attention. All the other stakeholders playing very important roles in that, but patients should lead how healthcare is changed and how the practice of medicine is changed every day with technologies. I think that we are not prepared. If we were prepared, then it would have been the case already, but it's not. We are not prepared. Medical professionals, patients, policymakers, researchers, nurses, we have never been trained or educated about this technological explosion. So we are not ready. But if there would be a guy that could help us, that might lead us to this very optimistic vision of the future of medicine. Let me share this very simple guide with you right now. My first point is the simplest point. All of us, we need digital literacy. It means that online, we should feel like at home. When somebody asks me about the quality of a medical website, I can tell them in seconds, because I have checked over 1 million medical websites literally in my life. I feel like at home when I'm in the digital world, just like in the offline world. So we need digital literacy. I know it's a struggle. Just like you, I face an ocean of information every single day. That's far too much. But I have some normal methods. I use Google Alerts, I use RSS, so I can fill up just one swimming pool out of that ocean. I still don't have that much time, so I have one glass. This glass is my social media network, my Twitter, Facebook, LinkedIn, Google+, blog, YouTube followers, and they can tell me which 3 articles to read that day. I have 500,000 assistants working for me every day. Just like how I work for them. That's how this community works worldwide. It doesn't happen immediately, but if you spend time with that, you're going to have the best assistants in the world working tirelessly for you every single day for free. If you want to have digital literacy, I made a free e-learning platform available based on the curriculum I teach at 2 universities to medical students. And the course is free for everyone, and if you go through these tests, you will have at the end digital literacy. I guarantee you that, because the tests are very hard, and I came up with the questions myself, so it's really worth it. The second point is that although I'm very optimistic about the future, we have to be a bit skeptic regarding bad technologies. Usually people tell me that, mostly medical professionals, that technology makes us antisocial. And it's a very negative thing, because we go to an underground station and we are all living in our smartphones doing this movement hours every single day. I think that's not technology that made us antisocial, because we used to behave the same way before, for different purposes. So it's about bad technologies. It makes us not being able to digest the information overload. I don't want to live in a world like that. This photo was taken at the Louvre Museum in Paris. Kids checking their smartphones while the masterpieces of art are around them. That's not a positive world we want to live in. This photo was taken a few months ago in California. A guy sitting at a fast food chain in the virtual reality device. I want to live in the real world, have real-life connection with patients, but use as many safe technologies as possible. So we need to be a bit skeptic about such bad technologies. Even though usually we are talking about improving healthcare and hospitals, healthcare is coming to our homes. I came up with this idea of a future bathroom with digital mirrors that can tell us our stress levels, blood pressure, pulse, or schedule, smart scales, microchips in the toilet letting us do a urine analysis immediately, smart toothbrush, smart home devices, bringing up the temperature by the time we enter the bathroom, and that's just the bathroom. I can give you 20, 30 more examples about how healthcare is coming to our homes. So when we talk about the future of hospitals, or the hospital of the future, that might not be an institution somewhere in the city, it might be your home, with some devices around my body or smart clothes measuring details and data which I need to be able to make decisions about my life. Well, my fourth point is the only thing I would like to ask you now. Please read as many books and watch as many movies in science fiction as possible. I'm not saying this as just a science fiction geek, although I am, but for decades, we have been stealing ideas from Hollywood, and these movies and books give us some great suggestions about that, although I think it's time for Hollywood to steal from us. And that's why we need to be in the absolute forefront of innovation. That's why we need to keep on talking about the ideas we have, startups, opportunities on Twitter, using the right hashtags, on Facebook, on YouTube. This global discussion should not end when we leave this conference. It should go on for months and years, constantly having this chance to talk to people. I can tell you that professionally, I am never alone. I can always turn to someone on any of my social media channels and ask really important or complicated questions, and I always get my answers. I am never alone, and that's an amazing feeling. I want all of you to feel the same, either as patients or professionals, either in the real world or through digital channels. Then it takes me to my fifth point. I believe that it's not enough to improve healthcare. It's not enough to improve digital services around healthcare. We need to become pilots of our health. And now we can do that. We can do health management quite properly. For a few years, I've been measuring my sleep quality just to make sure I can be energized in the morning. It's a very small device, it's a very cheap device. And by wearing it on my wrist, I learned that it doesn't matter how many hours I sleep for. What matters for me is that if I have one long deep sleep period, I'm gonna be refreshed just like that in the morning. So I had to find my lifestyle decisions or my mistakes before going to bed that make me have a bad night's sleep. And now I know what I need, and I don't use the device anymore because I have the data already, which I needed. Although I didn't wake up really efficiently, so I started using a smartwatch just to make sure it can check the best time to wake me up. I give it a time period, and in the morning it checks my movement, and at the right time it wakes me up with one gentle vibration. No sound, just one gentle vibration. So I have two small cheap devices, two assistants working for me every morning just to make sure I have a fresh day and I can wake up just like that. I think it's a jackpot situation. I use an American device, a Fitbit, to make sure I have my 10,000 steps every day. And even though when I don't have it in my pocket, I still use and still choose the stairs instead of the electric ones because I feel better when I move more and more. Plus, if I move more, I can function mentally better and better. That's what I learned by using devices to measure my data. I measure blood pressure once a week with a smart monitor just in case. I can measure an electrocardiogram right now, and someone asked me, why would you measure an EKG at home? Well, I measure because I can. That's the freedom I have. I don't have to go to a clinic, pay and get a paper-based EKG. I can do that whenever I want to, and this freedom gives me power to do my health management. I have a smart fork to make sure I eat properly every day. I have a tricorder from China, which can measure my blood pressure, pulse, oxygen saturation, sleep quality, daily activities, about a dozen health parameters in one device. My cognitive functions are very important for me, so I play games backed by neuroscience to improve my cognitive skills. I listen to music which can generate the best potential focus when I need to focus for hours. I found these methods and solutions around myself to make sure I can have health management and I can work when I want to work in a focused way. I can measure my brain activities during meditation sessions with very simple devices. I can measure my stress levels in a few seconds or 1-2 minutes. And it's important to learn these things about yourself, so through health management, I can make better decisions in my life. So we need to become pilots of our health. For hundreds of years, physicians have been in the cockpit, accessing data, and patients haven't arrived at the airport. Now, for about 2 years' time, patients have been in the cockpit, accessing data about themselves, and physicians are nowhere to be found. We need to put them in the same cockpit to access data as easily as possible, either at the hospital or at home using any kind of these devices. So, my last point is, we need to gamify our own health. We need to be proactive. My wife goes out for a run because she needs social motivation. I go with her. I go out for a run because I can measure data. I'm a geek. What matters is we need to find our own motivation to have health management. So through the ways I'm trying to live a healthy life with technologies, and through the ways I'm trying to improve my job every day and cognitive skills, I'm trying to change healthcare. And that's what we need to do right now, individual by individual. I hope that you will join me in this quest. Thank you.